People turning 65 have a lot of important decisions to make. Do they apply for Social Security or do they wait until they're older? When do they apply for Medicare? What are the differences between A, B, C, and D, and which ones are right for them? To answer these questions, I talked with retirement management advisor Marcia Mantell to provide some guidance to those having to make those decisions. My guest today is Marcia Mantell, one of the country's foremost authorities on Social Security and Medicare, along with being a nationally recognized keynote speaker, author, and retirement planning expert. As founder of Mantell Retirement Consulting, she has spent over 3 decades helping financial services firms, advisors, and everyday Americans navigate the complex rules of retirement. Before launching her firm, Marcia served as Vice President of Retirement Products and Marketing at Fidelity Investments, where she developed IRA and small business programs and acted as Fidelity's retirement spokesperson to the national media. Marcia takes dense government rules and translates them into plain language that people can actually act on. She holds the Retirement Management Advisor designation and the National Social Security Advisory certification. Welcome to the show, Marcia.
Thank you very much. I'm delighted to meet you and to get to have a conversation with you today.
Absolutely. I talk a lot about on this podcast and have a lot of episodes about getting to retirement, turning 65, whether you retire at that point or not. There are things that really need to happen that you need to do, whether you're going to work till 70, 75, whatever it is. So it's good to talk about what happens when you retire or when you get to 65, and making sure that you navigate all of those rapids, as it were, and not crash on the rocks. So,
It's a great analogy.
yeah, that said, most people know they need to sign up for Social Security and Medicare, but when does that process actually need to start, and why do so many people miss the window?
It is a complicated system, Stephen. I mean, there is just a lot of confusion out there, partly because, in my personal experience, people start too late or they start too early. So by too early, I mean they're 55, they want to retire. They say, I'm going to be done by 60. I'm claiming Social Security at 62. I've earned it. I want it. It's mine. But it turns out that can be a pretty big mistake for most people. So that's the starting early people. The people who start late, it's more on the Medicare side, is what I find, because they don't know that they need to sign up proactively in many cases for Medicare. And it's not clear. What I get a lot is as people are turning 65, I get the panicked phone calls from regular people and even financial advisors a lot of times going, oh my gosh, I have a client turning 65 on April 7th. It's like, okay, well, what's the situation? Is he working, not working, covered by a large group plan or not covered by a large group plan? You have to start to peel this onion.
Mm-hmm.
But, for the 40 or 45 years we've all been working, we've just been covered under a large group employers plan for the most part. Every November, we check a box, say, yep, I want my health insurance again next year. And magically on January 1st, it starts. And then, so your analogy about the rapids, I love that. I use the cliff. What happens is people are reaching 65 is they stand on the cliff and then someone shoves them off and they didn't know what to expect. So it is really, really complex. And everyone's situation is different. There's no hard and fast rule. Don't listen to those mailings coming from, every insurance company under the rocks here saying you will be penalized if you're not in Medicare at 65.
Mm-hmm.
That's for some people, but
Mm-hmm.
not for everyone. And figuring out, where do you fall and what's your enrollment window depends on a lot of different things.
Mm-hmm. Well, it can be difficult, like, for example, with police officers, or I think teachers and other professions, the military, where retirement is often much earlier
Mhm.
than 65, where you have police officers maybe retiring in their 50s, or at least they're fully vested and can retire, and then go on to do other things while collecting their policeman's pension. So they're
Yes.
retiring, but they don't think about, all right, I'm retired, and then they turn 65, and then they have this issue. And as I understand it, that there's actually sort of a 6 month window that straddles your birthday. So there's a window that's the 3 months before and the 3 months after you turn 65. And even though you may not be retiring just yet,
Hmm.
you do have to claim, and the penalty does come in, as I understand it, if you don't put in for Medicare Part A, which is hospitalization, right? Is there a problem if they miss that 6 month window around the birthday for Medicare A?
No, there's not. That's the good news. There's no penalty for Part A. The
Okay,
penalties that people hear about, it's for Part B and Part D. But let
okay,
me back up and address some of what you said, which is so interesting.
right.
You're completely right. Depending on the career you've had, and I'm working with a firefighter in Illinois right now. He's reaching 65, I think in August, and he wanted to know, like, do I have to sign up for Medicare? His wife does not carry the insurance. Has a solo business. So he does, but I couldn't tell him yes initially until I knew how the Illinois pension worked.
Hmm.
Some pensions come with health insurance still.
Hmm.
Some pension plans come with health insurance, but only as a secondary payer. So
Hmm.
you have to have Medicare Part A and Part B and do that before your 65th birthday month. And then the pension comes in underneath as a secondary payer, their health insurance program. In his case, he didn't have any of that. But you have to uncover those situations where New York State is completely different. The New York State workers, for example, they got to stay on the New York State health insurance, but only as a secondary provider. But they must be in Medicare by their 65th birthday month, even if they're still working.
Hmm.
So this is what I mean. It is so complex how anyone figures this stuff out. It's kind of crazy. But the one thing that does not apply, that many people think does apply, is you do not have to have Medicare Part A the month that you turn 65 or even the 3 months after.
Hmm.
You don't. If the condition is, do you have health insurance from a large company? By definition, for Medicare, that's a company with 20 or more employees, more than 20 employees. If you are working in a company, you're working at Fidelity, my old stomping grounds, right?
Hmm.
You don't need any part of Medicare when you're 65 if you're still working. Your
Hmm.
spouse doesn't need any part of Medicare if they're still working. However, if you applied for Social Security early, Medicare Part A comes automatically attached to Social Security. So the person who signed up for Social Security at, say, 63 because they retired early and now they want it, they can sign up for Social Security. What they don't know, though, is they've automatically also signed up for Medicare Parts A and B. And so about 2 months before their 65th birthday, they get a big package in the mail that says, "Welcome to Medicare." And they go, "What the heck is this?" And all of a sudden they're in A and B. They cannot decouple Part A, but you can delay or you can suspend your Part B if you're covered by a large group health insurance plan from your spouse, for example.
Well, let's
So,
break down the alphabet soup for a moment, just so the
yeah,
listeners are clear on what we're talking about. Medicare A is hospitalization. If
right.
you're in the hospital, covers the hospital bill.
You have to be
Medicare
an
B,
admitted patient,
an
not just in the
admitted patient.
hospital. Yep. So
Right,
if you're in the ER, that's not Part A.
right. But Part B is doctors, physicians, other medical providers. So you can run into a mixed bag. If you're admitted to the hospital, Part A will cover the hospital bill, but there's still the issue of all the providers within that hospital that may bill separately.
And
Uh,
will, yes.
it will, and that can run. People run into that even with their own private insurance, where the hospital may be in network, but the anesthesiologist or
Or the
the
radiologist.
the OBGYN or
Mm-hmm.
whoever within the hospital is with a different group that is not in network, and
Right.
that can be difficult. So what becomes even more difficult is you say, well, if you're still working full time, et cetera, et cetera. And as I mentioned before we hit record, my wife went through this where
Mm.
uh, She turned 65, but she was still working, was not going to retire until she was 67,
Okay.
to a great, good extent because I'm younger than she is and I had to be 65 because she carried our insurance for us. So,
Very classic. Yeah.
right. So, she turned 65 and she signs up for Medicare A,
Hmm.
and that becomes secondary to her regular
Group.
health insurance. And
Yep.
then when she retired and no longer had that insurance, then she flipped it. And under the federal system, at least her health care package, it just simply becomes secondary. It becomes your supplemental insurance, your Medicare supplemental insurance uh, for that. So then I turned 65. And then, so I claimed A, and then when she retired at the beginning of the year, I went through a special open enrollment to add B. So now we're both, even though I'm not retired yet, we're both under this Medicare A and B coverage. Now, D, just to continue the discussion of the
The
alphabet
alphabet.
soup, D is for drugs.
That is
That is
correct.
the Medicare prescription program. It turns out uh, her retirement package and insurance is has a better drug plan than D, so we're not
The
claiming
creditable
D.
plan.
Right.
Yep.
So what is C? What is Medicare Part C?
Yep. Great question. And I also explain Medicare as ABD,
Ah,
and then I eventually get to C. So
right,
Medicare Part C is an alternative or a substitute to Medicare. It is the plan marketed as Medicare Advantage plans when you see all the 8 million commercials.
right.
Um, it is a package by an insurance company that the way it works is you still have to enroll in Medicare Part A, hospitalization, and B, your doctors.
Uh,
You pay your Part B premium.
right.
And then you can say, okay, insurance company, I'm going to hand over to you all of my rights and benefits of Medicare A and B, and
Uh,
you're going to manage them for me.
uh,
And so it's a completely different way to get your health insurance as an older person in America.
uh,
And what it does, you will go to a network typically because you want it's a lower premium than you're going to pay for a Medigap insurance, a supplemental plan. So you pay a lower premium, you go to the local network of doctors and hospitals, and you pay all along the way. I call it the nickel and diming to death. You get hit with 20 bucks here and 30 bucks there and 150 for this service or $100 for that service until you reach an out-of-pocket maximum
mm-hmm,
that this year the federal mandated maximum is $9,250 for in-network, just under 14,000 for in and out of network.
mm-hmm,
So you're going to pay all along the way.
mm-hmm,
You'll have your drug plan, your Part D plan comes coupled with your Part C plan.
mm-hmm,
So it's really a Part CD combo.
mm-hmm,
But you are turning over the decision making to the insurance company. And
mm-hmm,
this is where you may be hearing things like there's a lot of prior authorization. So if you need an expensive drug, if you need particular chemotherapy or radiation procedures, you don't get them
mm-hmm,
until the insurance company says, okay, Marcia, yes, we agree with your doctor. You can have them and we'll pay for them.
mm-hmm,
But I got a call last week, Steve, that I was shocked, and I'm trying to loop back in with this couple. He, in his words, he got sold a Medicare Advantage or a Part C plan.
mm-hmm,
Now he has some health crisis that requires a surgery. He's been denied.
mm-hmm,
The insurance company doesn't think he needs that surgery. And so this couple was handed an estimate of $109,000 to get whatever it's something very serious health
mm-hmm,
wise. And now they're scrambling. They don't have $109,000 to pay for this. The insurance will not cover it.
mm-hmm,
And now they're stuck and they're in a state where you can't just say, you know what, I don't want that Medicare Advantage plan then. I want to go back to original Medicare, A, B, and a Medigap so
mm-hmm.
that I can have this procedure that I need and have it covered. So
Can
you
you
got to
go back?
really
Can
be
you
in the
do that?
game here.
Can you go back if you're on Medicare Advantage? And yeah,
Not usually in most states. So New Jersey, you cannot. In Massachusetts, I can. So Massachusetts, New York, Connecticut, and Maine have what we call continuous open enrollment. So you can go back and forth. So in other words, go from Medicare Advantage Part C into Medigap, even when you're older and sicker.
Mm-hmm.
The reason most states don't allow you to do that is you're older and sicker when you want these flexible Medigap plans, but
Right.
you have been paying your share all along.
Mm-hmm.
So, it's not fair. It's not fair
Right.
to the members who have been paying all along. And, from a profit revenue side of a business and from the insurance business, it's not a good, it's not a good business decision. So we all have to make that call at the point of getting into Medicare and then think of it as a 30-year decision.
Well, it's good you brought that up as well. Now, is my understanding that um, Medicare Advantage works more like an HMO and Medicare it acts more like a preferred provider system? So
A
that's why
little
you have to
bit.
get prior authorization or a referral because it's an HMO program.
Yes, and sort of. Yes, you need prior authorizations and referrals in the HMO side of Medicare Part C plans, but
Mm,
they also offer, most insurance companies also offer a PPO variety, which is similar to the Medigap. Medigap is full flexibility, is how
mm,
I think of it. You pay a monthly premium. It's not cheap. I mean, in Massachusetts, our Blue Cross Cadillac plan is $233 per month per person this year.
mm,
So the Medigap premiums tend to run from about $150 a month per person to I've seen them as high as $500 for a Plan G, which is the Cadillac in most states.
mm,
So you have to have the budget and know that you can keep going on that monthly budget.
mm,
Where the HMOs tend to be in the $0 monthly premiums to be in this substitute plan, up to about $300. And then PPOs on the Part C side usually carry a premium more in the low $50 or $75 a month, up to $400 or $500 a month.
mm,
So the problem though is when you're in the Medicare Advantage PPO, you, the patient, or you, the individual, if there's someone in your network, if you need a specialist not in your immediate network, you can go to someone outside of the network. You pay a little bit more. However, you first have to get permission from either that clinic you want to go to or that specialty hospital. You want to go to the Cleveland Clinic, but you live in New Jersey. You need to call the Cleveland Clinic, and ask, will you accept my insurance?
mm,
So you really have to be in the game when you choose a Part C plan. You are willing to advocate for yourself. You're willing to fight for your, procedures and drugs that you need. Um, and you have to change it or reshop it every year because the doctors come in and out of network a lot. So I had a situation last year coming into 2026 where a woman had a Medicare Advantage plan. She had a cancer diagnosis early in 2025.
mm,
Then she found out during the open enrollment period in Q4, the fourth quarter, that her regular primary care doctor was still in the network for her plan. It was a PPO,
mm,
but her oncologists were not.
mm.
They decided they're not getting paid well enough or timely enough or whatever issue, and they came out and they no longer accepted her insurance. So it was a mad scramble. This is a woman under active chemo treatments.
Oh boy.
So I don't have great stories to tell you the truth on the Medicare Part C side. If you get sick,
Well,
if
that's
you're
I start
healthy,
starting to wonder what the advantage is to Medicare Advantage. Uh, but I think
back in
that
the 90s, there were some advantages, to be fair, and why Congress allowed the insurance companies to name these products Medicare Advantage. First of all, they're not Medicare. And second of all,
that's
there's
right.
not a whole lot of advantage today.
Right.
But back when they started, there was no drug coverage. Part D hadn't been invented yet.
Okay.
So the Medicare Advantage plans allowed you to get cost savings on your drugs.
Okay.
And today they still offer a few dollars of savings on dental if your
Mm,
dentist will take the plan, or vision if your
mm,
eye doctor will take the plan. But you got to check all of this. It's
mm.
not a guarantee that your preferred physicians are interested in your insurance.
And that's where it gets confusing too, because I had heard of Medicare Advantage, but I hadn't heard about Medicare C, and that they're the same.
They're
And
the same.
also because they include the word Medicare, I would think that there's a lot of confusion out there when people are trying to make this decision. You're turning 65, you have to make an election, or you're getting ready to do this. You're getting mailings from everybody who wants to be your supplemental carrier. And we got stuff from Medicare Advantage, and
Yeah,
people don't understand. I would think this is Medicare Advantage. Maybe this is a supplemental plan,
right.
and they get confused. And I think that if our listeners take away nothing else from this episode, look carefully at whether you really want Medicare Advantage or the standard ABD program,
Right.
because it
With
can
a
make a big
Medigap.
difference.
Yep. And I call it now, someone gave me this turn of phrase, ABDG. And
Mm-hmm.
G is the Medigap Plan G, which is the
Uh-huh.
one lettered Medigap plan in almost all states, all but 3 states
Mm-hmm.
offer the standard lettered plans. There's a plan A, B, C, D, which is also confusing. But then G and N
Uh-huh.
are the most popular plans. Almost everyone gets a plan G. G is in George
Uh-huh.
when you get a Medigap plan. So ABDG is sort of the
Mm-hmm.
magic combination that gives you the maximum health insurance coverage one can have in
Mm-hmm.
retirement.
Mm-hmm.
And it comes with a price tag, yes,
Right.
but so does Medicare Part C.
Right.
It's just hidden.
And if you choose not to go private for the Medigap, that provides a nice package from the feds, the ABG,
Mm-hmm.
which gives you that gap insurance. So
Exactly.
let's go on to the next question, which has to do with these deadlines and everything. What would you say is the single most common and costly mistake people make when applying for Social Security as opposed to Medicare, and how do they avoid it?
For me, the single biggest mistake is that in all of the confusion and all of the sensational headlines,
Mm-hmm.
people really think Social Security is going bankrupt any minute now. And so they jump in and claim early,
Mm-hmm.
which will be a mistake when they're old.
Mm-hmm.
And they end up thinking that they need to jump in early. So if there is a clawback or a reduction in benefits coming,
Uh-huh.
they're going to be grandfathered in.
Okay.
And I hate to be the one to tell your listeners, Stephen, that there ain't no grandfathering with Social Security. So the way the program works by law is there are 3 funding sources. So the money that goes into the Social Security checkbook, as I call it,
Mm-hmm.
there's our payroll taxes, there's interest on the reserve account, savings account, and there's taxation of benefits.
Mm-hmm.
That's it. Now, off to the side is this rainy day fund, the reserve account.
Mm-hmm.
That's had all the surplus from years when Social Security brought in more in payroll taxes than it paid out to the retirees.
Mm-hmm.
It's that savings account that's being used today to pay the retirees, and it's the piece running dry.
Ah, okay.
It runs dry, and it will in 2032 ish. When it runs dry, Social Security can't bring any other funding in. We can't just grab from a slush fund or have the federal government just give it a bunch of money.
Uh,
Congress would have to make a change to allow that. So there's no grandfathering because the only money coming in will be the payroll taxes at that time.
uh-huh.
And they can then pay out about 78% of the benefits that are due.
Mm-hmm.
So people make a mistake on 2 fronts. They start too early because they think it's going bankrupt, and then they think they're going to be grandfathered in. They're not.
Right. And they're better off, I would think, that you wait at the higher benefit. So even if there is a reduction after 2032 in the benefits, you're reducing it from a higher figure than the one you had before. So,
Absolutely.
yeah. So
That is
that's
so
what.
important to have the bigger base number, I call it. So
Mhm.
start as late as you can reasonably afford to wait.
Mhm.
Not everyone can wait until age 70. That's where you get your ultimate maximum benefit amount. because you
Mm,
get your own benefit plus 8% per year for
mm,
those extra 3 years. So, it's a big boost. It's almost $1,000 a month for most
mm,
people of additional benefits. So it's better if you have a bigger starting payment
mm.
because, first of all, Medicare Part B premiums will automatically reduce your payment anyway once you have both programs going.
Right.
And then if we all get a cut in benefits in 2032, you're getting a cut on a larger base number. So your cash flow is better.
Right.
Yeah.
So that's so as I understand it, the earliest you can claim is 62. And then from 62 to 67, there's an offset. In other words, if you're getting Social Security and you work and earn a certain amount of money over a cap,
Yeah.
then they can reduce accordingly your Social Security benefit. So if you make uh, $300 over the cap on your job, they'll
Mhm.
reduce that the next month's Social Security payment by $300. But once you turn 67, and from 67 to 70, you don't have that offset. And then but after 70, you're not going to make any more money. You're not going
You
to get any
can.
higher benefit. So
You actually
I
can,
did
but it,
67 because
yep.
I wanted, it was sort of a balancing between maximizing my benefit and not waiting too late because you never know. You can die when you're, 68 and
Right.
then
And
never
then
get
you
the,
had never claimed, right.
right.
That's a real consideration.
Yeah.
But yeah, let me just comment a little bit on this offset. It's really a clawback,
Right.
or a temporary withholding of your total monthly benefit.
Right.
So in your example, you're exactly right. If you're under full retirement age, which is 67 for most people today, anyone
Mm,
born 1960 and later, you need to be 67 to be deemed retired.
right.
Once you're deemed retired, if you're still working, you can still work. You can make any amount of money you want and you can claim your Social Security benefit, and there's no temporary clawback. If, though, you claimed early, you first of all locked in a permanent reduction in
Mm,
your income. It's a
mm,
30% reduction if you claim at 62 and your full retirement age is 67. So it's a huge, huge reduction in a benefit that most people would say isn't as big as they thought it should be.
yeah.
But it is what it is, right? And
Mm,
now you're taking automatic 30% off because you claimed 5 years early. But people want to claim early and keep working and making 80,000, 100,000, $200,000 a year.
mm,
Well, the earnings limit cap is just over $20,000 for the year.
yeah.
So the concept of Social Security retirement benefits is that you're retired. So if
Yes.
you're still working, making a lot of money, you are not retired. And Social Security says, no, no, you can't have both. So they're going to claw it back. You will get nothing per month. They don't do a pro rata adjustment. Instead of getting $2,000 a month, you get 1,900. No, you don't get anything in January, anything in February, March. You can go all the way through November. Maybe you get 1 month of a payment. But all those months where you had zero, they get recalculated back into your benefit calculation as if you hadn't claimed that early.
Mm,
So it's kind of this convoluted thing, but it makes it fair,
mm,
more fair. And the other big piece that people don't understand for spouses, so I'm married to Dan. If I were an at home mom for my whole career and Dan claimed early, but then had these clawbacks, I would not be able to get my spousal benefit. Spousal benefits or minor children who can also get paid on a worker's benefit.
mm,
No one gets paid in a month where the worker doesn't get a payment.
mm,
So no one's getting any money coming into the household if you're over that earnings limit. And usually it's by a lot. Most people aren't at like 22,000. It's 22,000 and change this year. So they're not at 23,000.
mm,
They're usually at 100,000 or
mm.
50,000. So yeah.
So that's the next question I think we pretty much addressed, which is how to decide when to claim.
Hmm.
What factors matter most, et cetera, et cetera. It seems to me that you know, if you're never truly retired until 67 because there's always going to be an offset. So,
If you're working,
right.
you
And but
know,
if you are going to retire at 65, that you really are going to retire, then it's just a matter of determining whether you want to wait another 2 years to maximize your benefit. Because if you're
yes.
truly retired, there's no offset. That is not a factor in claiming before 67. But you need to make a decision as to what's going to work for you long term in the benefit at 65. And just look at, and Social Security will tell you
They
this is what you
do.
can earn at 65. This
Yep.
is what it is at 67 per month, whatever. And you can
Yep.
decide whether that differential is worth waiting another 2 years.
Yes. So I look at it in terms of, you're exactly right. Social Security tells all of us it's on your statement. You sign up on Social Security's website to get your special behind the login access to your statement. SSA.gov is the Social Security website. And you take a look, they show you in a bar chart. Like you're going to get, $3,000 is your what they call PIA, your primary insurance amount.
Mm-hmm.
That's the amount you get when you're deemed retired, right, at 67. So say it's $3,000. But if you want to claim 2 years earlier because you really are retired, you claim at 65, well, you get about 13% less. Don't do the math, it's on your statement. They'll
Right,
tell you. So it makes it pretty easy. You do look at that differential, but it's in terms of the cash flow into your household.
right,
So once you're retired, there's no more paycheck coming in, right?
right,
So nothing's fueling your checkbook except your personal resources.
right.
So that Social Security becomes a really important line of cash flow for households. And it takes on a double level of importance if you're the higher earner in a married couple,
Mm-hmm.
because the higher earner needs to think about cash flow coming in today, yes,
Mm-hmm.
and also think about what happens when the first spouse dies. Never a pleasant subject to talk about, I
Right.
know. But we have to be really practical. Someone's going to die first. Am I dying first or is Dan dying first? Well, Stephen, in my examples, Daniel always dies first. So he's the slightly higher earner. So I said to Daniel in my charming wife way, hey, honey, you're working until 70 and waiting to claim. I'm claiming at full retirement age. So you know, it does help us maximize our cash flow while we're both alive and hopefully having a wonderful retirement. But we do have to have that eye on, oh crap, what happens when the first of us dies? You
Mm-hmm.
lose one benefit. That's
Mm-hmm.
the real shocker for most widows in particular. They're used to getting $4,500 or $5,500 a month coming in from Social Security because there have been two payments. As soon as the first spouse dies, immediately that is shut down
Mm-hmm.
and you go down to one payment, it's the larger of the two between the spouses. So you really want to think about maximizing the higher earner's benefit amount.
Mm-hmm.
Um, and it's not so easy to wait till 70.
Well, another consideration too is you're saying, all right, if I retire at 67 and I might make more at 70, well, if you hold off on getting the Social Security benefits, then you may well be drawing on other retirement accounts, your IRAs, things like that. And you have to look at if you took Social Security now and that money stayed in that investment account, how much more would it grow in the intervening 3 years versus the increased benefit you would get at 70 over 67? And it's that balancing. So,
Absolutely. And then add in the tax piece as well.
right,
Because if you only have, lots of families only have qualified money and Social Security.
right,
That's really, they don't have non-qualified. So qualified money, tax deferred
right,
IRAs, you saved in your 401k or 403b, and now it's in an IRA.
right,
That's all taxable money. You only own three-quarters of it
right,
because the other is your deferred taxes.
right.
So you have to look at that. And what we're seeing is people who have 1.5 million, 2 million, $3 million that they've been able to save up in their 401ks over decades,
Right.
that becomes a tax problem because you're going to have high taxes or higher than you thought you would taxes throughout your retirement. And Social Security is a taxable income line item on
Mm,
the 1040. So
right.
you do have to, you're looking at all these metrics to decide
Mm,
what's going to work best in my household. And it will not be what worked for your brother or your cousin or the neighbor down the street. This is very personal to see how much money and how many sources do you have to create your own income.
and to consider, again, as I understand it, required minimum distributions on your 401k, your converted 401k, your traditional IRA, your SEP, depending on when you were born, may not start until you're 70 or 71. So,
Actually, up to 73 and 75 now, if you can believe it.
exactly. So, you're not required to take that money out.
Right.
So if you claim earlier for Social Security benefits, you don't have to take as much out of your other investments. It
Right.
continues to grow without your being required to withdraw it until even after you turn 70.
Yes.
So you're losing a fair amount of growth by taking the money out earlier just because you wanted to defer Social Security. So there's that balance
Yes,
as
you're
well.
losing growth potential, but you may end up doing what we call tax bracket creep. So
Mm,
then at 75, when you start your required minimum distributions, age 75 is for anyone born 1960 and later. Those born in the 1950s, not all the 50s, the later 50s start at 73. But yeah, you lose the growth potential. But if it ends up that your required minimum is so much bigger that you move from the 22% bracket to the 24% tax bracket, then you've lost the growth. Yes, you had the growth technically on paper, but now you're paying more to Uncle Sam.
mm,
So it really is weighing these different scenarios to see, but it often comes back to exactly what you said earlier, Stephen, that you might not live to 68. You might never make it to RMD.
mm,
And a lot of people, they're so surprised that they have to think about retirement as a 30-year runway.
mm,
That's a shocker right there. Like, no, there's no way I'm going to live till 100 or to 95. Yeah, you probably are. But, the odds are very good that
mm,
if you're in a relatively healthy, if you're healthy at 65, you got a good shot of making it well into your 90s.
mm,
So, this longevity piece is the wild card
mm.
because if you're trying to stretch all of your assets out over even longer than you thought,
Mm,
that's one strategy. If you think you're dying at 68, well, that's a completely different strategy.
right.
So everyone has to grapple with this because there's not a clear and clean answer.
Mm,
It's the best answer that you and if you're married, your spouse can come up with and
mm,
live with the trade-offs. You're going to trade off something somewhere, either a little bit of growth in the 401k IRA
mm,
or a little bit of not getting these extra bonus points in Social Security.
mm,
But when you see it on paper, you'll be able to make a really good decision for you.
mm,
And it works for individual couples
mm.
and individuals.
So, I mean, I guess the lesson here for the listeners is it's complicated and it depends, but you need to consider these factors. It's not a dead bang rule. It's not the same for everybody. You want to make so there really isn't an answer to the question of when's best to claim because it's whatever your situation is, but you need to consider all of these factors. Now,
Right.
before
One
we
thing I
wrap up,
will say, though,
mhm,
I completely agree. One thing I'll say about Social Security, though, you cannot bequeath those dollars.
mhm,
Once you're dead, you're dead. Those
right,
dollars don't get directed anywhere except to a spouse if you're the higher earner. And then
right,
once he or she is gone, they stop. Right.
right.
So you can't control those. Your own personal money, you get to be the decision maker on the beneficiaries. Where's this money going? Where do you want it to go? So a lot of times people will say, I want to protect as much of my own money that I control and can direct.
Uh,
So I'm going to claim Social Security at full retirement age, let's say, so I don't have to touch. Less about the growth potential is there also, but they really want to be able to direct that money, especially if you have grandchildren. To
mhm,
your anything extra goes to the grandkids, college, to a charity, that sort of thing. But yeah, you don't direct your Social Security money.
Hmm. Oh, and that's an important point. I mean, it from an estate planning standpoint, how important is legacy to you? You
Right.
know, or do you want to have a legacy to pass on when you die? Or is there a bumper sticker on your car that says we're spending our children's inheritance? You know, which I always love that. I'm like, you go.
Yeah,
It's
exactly.
yours. You earned
I
it.
mean,
Spend it.
everybody falls differently, right? It's not right or
Right.
wrong. It's just
Mhm.
what's your belief? What do you want?
Mhm.
Maybe your kids have 10 times more money than you do. They don't need they don't need any money, you know.
Well, before we
Oh,
wrap up, I do want to get to one more question, so we'll make sure that folks leave with this. And we talked earlier, and we started with discussions about Medicare enrollment. What happens when someone misses the deadline? Are there penalties as bad as people or think they are?
the penalties aren't that bad, but they are permanent. I'll cover
Mhm.
those in a second. What is the real problem? You don't have any health insurance.
Uh-huh.
There is no one to pay anything when you get in that car accident or have a stroke or have a heart attack. You
Uh-huh.
literally are uncovered, which we just can't do today in
Right.
America.
Mhm.
It's too expensive. So that's the real issue. Now, the penalties are as follows. If you missed getting in on time, whatever on time is for you during your initial enrollment period around age 65 or after 65, but you're coming off of a large group plan.
Mhm.
If you miss your exact enrollment, the penalty for Part B, B as in boy, is 10% per 12-month period that you should have been in Part B. The other issue is once you discover it, say here in April, it's April
Mhm.
1st today that we're recording, when you figure that out on April 1st, you cannot just willy-nilly walk in and get Part B
Mhm.
if you've missed your very specific enrollment dates.
Mhm.
You now have to wait until January of 2027 to
Mhm.
get in during the general enrollment period.
Mhm.
And so you now go the rest of the year with no health insurance. Oh my God, like that would be dramatically terrible.
Now, if
You
that's
get
if
in,
you retired, though, if you're still working and
right?
have health benefits through your
Then
employer, then that's another thing, right?
then you're fine. Then you're
Yeah.
absolutely fine, right? If
Not
you
to
if
scare people too much, but
yeah,
that's if you retire at 65, but miss the deadline to apply for Medicare.
yep.
Okay.
And again, Medicare Part A you can get into anytime. Part B you cannot. You
Okay.
either get in during your IEP, those 7 months around your 65th birthday month,
Hmm.
or if you're covered by that large employer's group plan, you have until 8 months after you leave that plan. But you don't have any health insurance during those 8 months.
Hmm.
So you really need to be like, if you're retiring at the end of June,
Hmm.
your Medicare A, B, D, and G all need to start on July 1st. It's a
Right.
coordinated effort. I'm rolling off my group plan and going into Medicare.
That's what I
So
was worried about, where I was waiting for B after my
yeah,
wife retired, that until I get that card, I'm basically not insured,
right. Well, so
which is
long as it's
scary.
in the in Medicare system, but absolutely. And it's terrifying for people when they realize this.
Hmm.
And so you do have to wait. The penalty is 10% per year, basically, that you should have been in.
Hmm.
And you can only jump into Part B during the general enrollment period, which is January, February, and March. So again, on April 1st, if you missed your enrollment period at some point in the past, you're stuck for the rest of this year.
Yep. So that's an important thing to remember. So at this point, so there's a lot that you do to help folks with this stuff. Tell us a little bit about what you do for folks and how they can get in touch with you.
Thank you. Yes, I do help. I mean, these examples aren't, made up examples. These are
Mhm.
real people trying to navigate the Medicare maze or the Medicare mess, whichever
Uh-huh.
side you want to call it. It is very complicated. People don't know that the law, it's the same law. It's called the Social Security Act, but it has Social Security and Medicare in the same law. So they're connected in different places and points,
Mhm.
and decisions you make or entry points when you're getting into one program can affect the other program.
Mhm.
So I help on a custom basis. Everybody's situation is different. They might call me and ask, can you help me with Medicare? And we turn out coming up with a Social Security strategy as well.
Hmm.
So I help individuals, individual couples. There's no group effort with Medicare and Social Security other than I also do webinars and such for general rules. But when it comes down to you and your wife, you and your husband, it is all custom. So I meet with you on Zoom. We go through your situation. We come up with your options or problem areas. I have a lot of problem areas with health savings accounts with Medicare and Social Security. So that comes into play. Look at employer benefits, or as we talked earlier about the different pensions. Every pension has its own set of rules. So I'll dig through your documents because Lord knows individuals don't know this stuff, Stephen. So that's how I provide, a roadmap and a custom timeline, plus all the operational stuff. Where do you apply? When do you apply? Which link do you click on? Go to the document that I designed for you and click on this link. How do you pay for your premiums if you're not in Social Security? So all that's mapped out for each individual person along the way. And the best place to reach me is through my website, which is mantellretirementconsulting.com. And there's a link to email me from there.
Okay. Well, it sounds great. Well, thanks for coming
Thanks.
on the show. There are a bunch of questions that we didn't get to. So I may well have you back to take care of the rest of the questions.
All
But
right. Well,
thanks for
anytime.
lots of good stuff for people starting to think about this. That if they're contemplating it in the next few months or have to do it in the next few months, they have much better information. So thanks for coming on the show.
Excellent. Thanks for inviting me, Stephen.
Mhm.